Welcome to the Infection Prevention and Control Training of Trainers video. Session 2. What is Personal Protective Equipment? PPE. This session will help you to understand the importance of using adequate and appropriate personal protective equipment, or PPE, in promoting infection prevention and control at your healthcare facility. You will learn about the different types of PPE and how they reduce the risk of infection transmission between patients and the healthcare providers. Adequate and appropriate PPE is an important measure in preventing contamination and reducing the risk of cross-infection. The following are the 6 types of PPE used in healthcare setting. The first type are gloves. These are worn as a barrier to protect the wearer's hands from contamination and to prevent the transfer of organisms already on the hands to the patients. There are 3 main types of gloves. 1. Disposable examination gloves, worn when performing routine activities such as examination of patients. They are not to be reused. 2. Utility or heavy-duty gloves,
which are used by other people who are involved in issues of cleaning, decontamination, the cleaning of the surfaces. We need to first of all put on surgical gloves or examination gloves. After putting on examination gloves inside, because they are tight, they cannot allow penetration, and therefore after that we now put on heavy-duty gloves, then provide extra protection.
Ensure that you wear clean utility gloves or heavy-duty gloves to avoid spreading germs during activities. Have them cleaned after use and correctly stored. 3. Surgical gloves. These are worn when performing invasive medical or surgical procedures. This is also for one-time use.
And you have to remove the gloves halfway, and then after moving halfway, again you move them halfway, and then you drop them out to make sure there is no direct contact with the second hand to the gloves and get your hands again contaminated.
When you expect to be in contact with blood or body fluids for longer than 30 minutes, a double surgical gloving should be used. Please note that
immediately after attending to the patient, the disposable gloves must be removed, and then the hands must be washed with soap before the provider attends to the next patient.
The second type is masks. Masks are to be worn on your face.
Mouth protectors are important if you are doing invasive operations where you expect spillages of blood and blood product.
They can also be worn when working in a dusty environment. Do not reuse disposable masks. Respirators are recommended for situations in which filtering air is deemed important for inhalation, such as when working in wards where multiple drug-resistant tuberculosis patients are cared for. The third type of PPE is the plastic apron. Plastic aprons are a protective waterproof barrier used to protect clothing from contamination and spread of bacteria. Before using a plastic apron, it is important to observe the following steps. 1. Remove plastic apron from the dispenser. 2. Pull the apron over the head.
Pay particular attention to the hair such that the apron does not get in touch with the hair, because you end up contaminating.
The fourth type is protective eyewear. Protective eyewear such as plastic goggles, safety glasses, and face shields protect the eyes from accidental splashes of blood or other body fluids. The fifth type is protective footwear. Protective footwear is worn to protect feet from injury by sharp, heavy items or accidental spills. The commonly used footwear are rubber boots or leather shoes, which are thick enough to provide extra protection to the feet. They must be kept clean at all times. It is important that if you are working in a clinic, you avoid wearing shoes that expose the feet, such as slippers, flip-flops, and sandals. The sixth and final type of PPE is the surgical gown. Surgical gowns are used to protect the spread of microorganisms between patients and the abdomen and arms of healthcare staff during surgery. In order to use them appropriately, 1. Always wear gowns or aprons if soiling is anticipated. 2. Only sterile gowns should be worn in the theatre. 3. All decontaminated gowns should be used only once, then discarded or laundered. This session introduced you to the importance of using adequate and appropriate personal protective equipment or PPE in order to promote infection prevention and control practices. You have learnt about the different types of PPE and how they are used to prevent contamination and infection. It is important to remember that PPE is not a substitution for personal and hand hygiene and does not remove need to control environmental hazards for staff and patient safety.